Kia ora tatou, ko Debbie Wilson talking. So yeah, I met you all earlier on today, the earlier session, and I'm really happy to actually get a chance to speak and share just a little bit of intel on the work underway within the Health Infrastructure Unit on greening healthcare infrastructure. Just remember I have to press that, it doesn't work telepathically. Okay, so I'm just going to start by talking a bit about policy context, and then go into facility design program and guidance, where we've got some new environmental sustainable guidance sitting within that broader design guidance notes. I'm just going to share a little bit of information about that before I wrap up. So this is a very busy slide, which is kind of neat because maybe 5-6 years ago, when I was working as a sustainability practitioner in a DHB, in Kansas Manukau DHB, if I'd have had a slide telling you about policy context, it would have been quite empty because there wasn't really much going on in that time as regards to all the fantastic changes as a result, direct result of the Climate Change Zero Carbon Amendment Act. As you can see on the slide, on top of that, we've had the climate emergency, which the PM announced in December at the same time as a carbon neutral government programme. So all of these things have been happening at the policy level, which need to translate into actions in the practitioner level and across the sector. And then on top of all that, we've got the health system reform. So there's quite a lot of work to be done and work across the sector and with the sector to really think about how we go forward and create the health system that we need and that we desire. And that's going to be fit for the future. Just a brief mention of the Carbon Neutral Government Programme and DHB's responsibilities. So I'm not sure if you're aware, but by next year, that's when DHBs are required or instructed, I think is the words, rather than directed to set up annual measurement, verification and emission reporting, and to set gross emission targets. And as Marguerite noted, actually, there's been a lot of work across the DHB space over the years in doing this very thing. And that's why we've got all that information and valuable work that's gone underway. But this has to be obviously across every single DHB going forward. And then we've also heard about the offsetting scenario. So by 2025, the public sector organisations are required to be carbon neutral. So of course, there's going to be some unavoidable residual emissions. I'm not even going to touch on that anymore now because I'm going to focus on infrastructure. But just to note the comments made by Rick in terms of what we capture within our emissions profiles is an interesting area we need to explore further. Okay, so I'm working at the Health Infrastructure Unit at the Ministry of Health, and then kia ora, I'm Ministry of Health whānau. I think a lot of you are online, and so kia ora there. And actually, I've been working a little bit with the facility design team and to help, I suppose, inject some environmental sustainable design features within that whole programme. It's a newly established team, and you can see there's a whole range of aims and practices that team are going to be working through and developing, and just to help the sector really thinking about that what the hospitals in the future, in the near future and in the distant future, what hospitals are going to need to look like, where they're going to be situated, what materials are going to be used, and what the impact of those hospitals are. And there's actually a lot of work going on in the health infrastructure, looking at service planning and models of care, and there's a lot of work. So I'm just focusing mostly here on infrastructure. So we've recently launched a guidance document, which is being piloted across the mental health infrastructure programme. And there's the extract showing you the table of contents, which has the environmental sustainability as a focal area, but I've highlighted the other words in green because, of course, everythings interrelated. You don't just work on environmental sustainability. Actually, it's the basis for a lot of the work streams, and as I say, it's all integrated and related. That's a picture of Te Aho Mai, by the way, if you didn't recognise it, on the Middlemore campus. So why are we thinking about greening our healthcare infrastructure? Well, buildings account for large carbon emissions. Hospitals especially, as we all know, run very large hospitals, run 24/7, use a lot of energy, a lot of water. Actually, a lot of wastewater as a result of that just goes down the drain. There's so many carbon hotspots there that we can work on and improve by building better and greener hospitals. So I'm not thinking about the existing assets. I'm focusing on what would that new hospital ideally look like? How are you going to feel when you enter that hospital? Just think about that. What would you like to see there? I've got some clear ideas there. And just to note that procurement guide was recently released, and it's focusing on building and construction and actually a guide to help you work through and how you actually lower your operational and embodied carbon of the construction processes. It's a really good guide. Okay, so we've developed some HIU sustainability principles from which 7 critical actions that we're piloting and trying. So we want all hospitals to be high-performing, healing environments. It's quite simple when you think about it. And high-performing, so very energy efficient, water efficient. Healing goes without saying, right? For the staff, for the patients, for the visitors. I've worked in hospitals all of my career, and I've been in some real dungers. They're not very nice, as David Pension mentioned earlier. But we also want them to be climate smart, adaptable, and resilient. So resilient to climate change. We're not going to build in a flood area, for example, because the 1 in 100 year flood events are not 1 in 100 year anymore, are they? We need to think about how in a time of climate emergency, are we going to get those supplies to that hospital? How are we going to get the staff? How the patient's going to get there? They need to be resilient, and adaptability is quite important too. And I've got 3-minute warning, so I'm going to speed up. And I think I don't want to rush over that great generating wider health outcomes foundational principle as well. And that's kind of referring to the anchor institution, actually performing a civic function at the time of need when the community's struggling. With the Aotearoa recently, with that weather event, actually, wouldn't it have been nice to provide a civic function at the hospital to look after that community? And just to briefly show you the critical actions that we've developed. And again, these are being tested, and we do need feedback. We need to apply these actions and actually learn from them and gather the data and evaluate, because these actions may change. But, we're thinking if we're improving the process and the planning, adopting a more integrated design process, and reducing carbon emissions, both operationally and embodied carbon using life cycle analysis to show that. And all those other 7 actions you see listed there, we're going to generate much greater outcomes. And almost finished. I just want to touch on this slide, which is one of the critical actions, actually selecting tools applied to project scale. And this is what Minister Little mentioned earlier, the 7 critical actions and the tools. So as you see, all large-scale new hospital developments over 50 million, we're saying that we should have Green Star 5 certification for those. And these actions and these steps actually do correlate with the Building for Climate Change programme, which is being led by MB. And that's basically revamping the building code. And there's other tools that we're very interested in. You heard about the Taranaki Base Hospital, the renal unit are going for zero energy certification, which is fantastic. So we need to learn from that process and find out the benefits of using that tool, the costs, what did it take in terms of resourcing, and what was the learning along the way. So we're very interested in finding more about that. And then core certification, I've put an asterisk there because that's very well suited to mental health units. And as I highlight there, life cycle analysis really should be undertaken for every single project. It's vital because you can set your carbon targets, your water, energy efficiency, and not just focusing on those operational ongoing costs and environmental impacts, but the embodied carbon, which if we don't start looking at embodied carbon, we're going to be locking in high carbon for the next 50 years or more. We are reviewing neighbours tool for hospitals, and discussions are underway with ECA and the Ministry around the advantages of that. So to wrap up, climate change, as you've heard throughout the whole day, actually presents us with many opportunities. There is a great deal of policy work underway, which is really heartening. We do need to keep up with that and actually, translate those policy settings into action and deliverables. The way we design healthcare buildings really counts. It really matters, not just from a day-to-day being in a hospital point of view, but just thinking about the ongoing impacts of those buildings. Using principles-based approach for those 7 critical actions, we think will actually help drive the change required. And guiding the sector will actually help the sector comply with the carbon neutral government programme. These tools have been developed to help provide guidance to meet the requirements of the CNGP. And, let's not forget, we are actually in this all together, and we have to work together on this one. And kia ora, that's me.